I am going to present an interesting case that explores treating maxillary central incisors diagnosed with crown root fractures via a treatment method known as intentional replantation with 180-degree rotation. It is an uncommon form of treatment for crown root fractures due to lack of awareness as a treatment option, and it is therefore infrequently published in dental literature. I hope that by presenting this case, more clinicians can increase their knowledge on this technique and utilize this as a potential treatment option for patients. In this case, our patient is a 19-year-old male who experienced dental trauma after falling off a ladder. This resulted in crown root fractures localized to the maxillary central incisors teeth 8 and 9, which were unresponsive to endo-ice and electric pulp testing. They were non-vital and tended to percussion. Both these teeth had grade 2 mobility, and a 4.5 millimeter probing depth was associated with the mid-lingual surfaces of the upper central incisors. The patient's presenting complaint was that he wanted to restore his smile as soon as possible, since he was only in the city visiting family for several more weeks and was due to return to college in another state where he did not have a dentist. He wished to retain his natural dentition and avoid removing his fractured front teeth. To maintain these teeth, there are a variety of conventional treatment options available. These include crown lengthening, orthodontic extrusion, and surgical extrusion. However, there are limitations with these treatment options, such as high cost, length of treatment, aesthetic challenges, reducing the crown root ratio, and risk of relapse. On the other hand, intentional replantation with 180 degrees has advantages over these treatment options. Firstly, the clinical treatment time is less. Secondly, the fracture line can be accurately identified. And thirdly, a normal crown root ratio is preserved. As we can see, the maxillary central incisors were carefully removed with forceps via gentle rotation motions to avoid compression of the PDL against the alveolar walls. The teeth were carefully rotated 180 degrees and immediately placed back into the socket, adopting a more extruded coronal position. Since the root shape is asymmetric, reinserting the tooth in a buccal-lingual reverse direction results in the apex being in a new position in the alveolus as it no longer reaches the base of the socket. The replanted incisors were stabilized with a splint for 2 weeks and a soft diet was advised. Root canal treatment was initiated after splint removal, and after 4 weeks, the canals were obturated. The teeth were then prepared for crowns, and lithium disilica Emax crowns were cemented as the final stage of treatment. The patient was followed up after 30 months and reported satisfaction with function and aesthetics, and the teeth were asymptomatic. The prognosis of this technique depends on periodontal healing, which is influenced by healing of the PDL. Trauma to the PDL should be avoided to achieve periodontal regeneration, cementum healing, and reduce the risk of resorption and ankylosis. To preserve PDL viability, extraoral time was kept as short as possible. This case shows that intentional replantation using 180 degrees rotation can be used as a treatment option for crown root fractures. By moving the fracture line in a more coronal position, the maxillary central incisors were restorable and more tooth structure was available and sufficient space present to accommodate the biological width. With easier access and isolation, the teeth could be treated more favorably, and the natural dentition and interdental pillar were also maintained. With the patient having significant time constraints, intentional replantation was a viable choice of treatment here. A successful outcome is dependent on preserving PDL health and biological healing. We can also adopt this interesting method of approach in cases such as subgingival cervical caries and perforations. I want to thank you all for listening to this presentation. I hope you enjoyed it.